Alrighty, so we are recording. I'm going to share my screen here. All right. So can everyone see my screen?
Yes.
Okay, so what I'm going to do is, before I do that, I'd like to do some Zoom housekeeping. So throughout the presentation, we may ask you some questions and we want you to like raise your hand, but there's a way to electronically raise your hand. So just in case you're not familiar with some of the features in Zoom, down at the bottom, like where the chat is and the participants are, you'll see reactions and you can clap, you can give a thumbs up, you can raise your hand. So you can have all of those functionalities there. So if you have any questions, you can feel free to look into the chat. I'll try to monitor the chat as well. I see your thumbs up, Lisa. Thanks. But if you have any questions about anything, feel free to put something up. I'll try to make sure that I'm looking at both screens here on the Zoom. And if you have a question in the chat, feel free to put it in there, and hopefully we can pause to answer your question or discuss your comment. Okay.
Can everyone see the questions in the Zoom chat, or can just you see them? Because I didn't see the thumbs up. It was a test.
Can everyone see what you have? Oh.
I see it.
You see it?
Okay, good.
Okay.
Okay, wonderful, wonderful. All righty, so let me go back to the screen one moment. Okay, so today is the Instructional Program and Course Approval IPCA Committee, focusing on mental health resources for allied health professionals. And here is the agenda. We have our fearless leader, Lisa McKay, who's the Associate Provost and Director of UCAWD. She's on the line and she will give greetings. And then you will see the rest of the agenda items. We have some wonderful presenters here ready to share all of their awesome insight on this topic. And then we have some open chairs who I will let Susan discuss. So first, welcome, and you'll see the agenda, and I'll kick it off to our fearless leader, Lisa McKay.
All right. Well, good morning, everyone.
Good morning.
Good
morning. Good morning.
Good morning. When Susan asked me to participate in the meeting this morning, she had said, well, you know, you're a mental health professional. Can you please offer some words of comfort? And I said, well, I haven't been a practicing mental health professional in a number of years. But I wanted to just welcome everyone to the meeting today and share with you how I've been getting through these times. The topic today is, you know, mental health and how that is so incredibly important, not only for ourselves who are delivering curriculum support services, but for our students. Some, if not all of you, might know at this point that I'm a COVID-19 survivor. So I got sick back in March, and in my mind have made a full recovery. So I'm doing quite well physically. Mentally, I can tell you that I am doing as good as I possibly can. And I think in a lot of times that's all we can hope for when things seem very uncertain. I've looked at the topics that you're going to be discussing today, and I'm looking forward to hearing the presentations. I'll tell you that I am a personal believer that good mental health is vitally important for us to be able to manage our lives. And it's not always necessary to wait for a crisis to avail yourself to support services. So also in the vein of sharing, my daughter is in her final semester, really like 3 weeks of college, and it has been quite a journey for her. And just about 2 weeks ago, I noticed that she was sounding very stressed when I was talking to her on the phone. And I said, Amber, you need to go and make an appointment with a therapist on campus so that, you can kind of talk about what's going on right now. And she said, why do I need to do that? Everything is great. Where school is out right now, it's going to be back in another week. I don't know why I need to do that. And what I said to her was, mental health counseling, in my view, is preventative. And I started to list all of the things that she's dealing with right now, not going to be able to have a commencement that she was looking for, so grieving for that. Having the campus look very different from the experience that she is experiencing or had experienced previously. Her mother being sick and making a recovery, having to come home and live with us. What 23-year-old wants to do that when she hasn't been able to find a job in this market right now? And as I started to talk, she started to say, yes, I think I do need to make an appointment and begin to take care of myself, just to have a safe place to talk about what's going on with your life. So I say all that to say, I'm glad that the committee is addressing or bringing this topic to this group, because sometimes, as you know, there's a lot of stigma around taking care of your mental health as well as your physical health. And so to the extent that I can try to break down those barriers, I want to be able to do that. We're all in this together. These are uncertain times, but I'm also very hopeful, and that everything will work out. And so as long as we're continue to remain tied to one another and support one another, faculty, staff, students, I want everyone to know that we're part of one community. And if there's anything that anyone in my office can do or that I can do, please don't ever hesitate to ask. So I welcome you all here today, even our visitors and those who are open chairing the meeting. It's good to see everyone, for those that I can see, and look forward to the meeting today. So welcome.
All right. Thank you so much, Lisa. Really appreciate that, and appreciate your sharing that very personal story. We're so thankful that you were able to come out on the other side after having to deal with COVID-19. And when you were talking about your family and just and dealing with just the pressure and the concern around your only child, your only daughter. It's just that type of heart work, I know, is something that you ask us to keep in mind as we're working together and looking to develop programs and services that truly meet the needs of the community. So thank you. I know it's a very busy time for everyone, and just really appreciate everyone taking the time out today to join us. And when actually Dominique Luke, who you met earlier today, one of my colleagues as well, from SUNY UCWD. And for those of you who may not be familiar with SUNY UCWD, or maybe this is your first time on this committee call, the Instructional Program and Course Approval Committee is a committee that typically has academic affairs advisors from across the system. We have centers that, we have 12 centers that range from, down in New York City through Long Island, through the Capital Region, up through Buffalo. And as part of our stretch, we also include, as part of what we do, our Attain Digital Learning Labs. And we have 35 of those across New York State, and they also span through New York City, the Capital Region, and as far up as Niagara Falls. And so all of us are working together to serve students that are typically economically and academically underserved, and students with a lot of perseverance. And you'll see from the presentations here today that we'll be talking from a very student-centered approach. We want to make sure that whenever we are developing programs and services, that we're keeping in mind that as professionals, we have a lot going on personally and as well as at work. Those of us who are in leadership positions, either supervising people or not, as Ms. McKay said earlier, we're all in this together. And so I'll be talking about the ONET, which is the Occupational Information Network. That's a U.S. Department of Labor tool, mental health and allied health professionals. And I was inspired by, helping to put this together and talking about that particular topic because of actually a family situation that I'll get into when I go into my presentation more. And so you'll be hearing about some tools and those of us who are developing programs and services. It'll be an opportunity to continue to talk about ways and share promising practices so that when all of this has passed, that we are in a better position than we were going into it, right? Oftentimes challenges make you stronger. Then we will have we'll have staff from Dr. McGarrity's team in Schenectady talk about breaking down barriers, and followed by Marsha Williams-Nichols from the Brooklyn EOC, who will be talking about, and Ms. McKay touched on this as well, talked about the connection between your mental health and your physical health. And so I'm just gonna ask you, if you are not presenting, I'm just gonna ask folks to mute your devices, so because we're getting a little bit of feedback, and it'll be a lot easier to hear one another. So I'm just gonna give folks an opportunity to do that. Okay. All right, great. All right, thank you. And so then we'll have an opportunity to wrap up with a Q&A and next steps. And so please do use the chat feature for that, and we'll be setting time aside to answer your questions. So I also want to, as Ms. McKay had mentioned earlier, we have open chairs, and I want to for those of you who may not be aware of that concept, the Research Foundation, it's a concept that some of us learned from our partners there as part of the SUNY Research Foundation. And basically, the open chair concept is you have someone who is an honored guest who is there to to participate, and so after the meeting, I'll have an opportunity to debrief with them and get recommendations about next steps, and it's just a really great collaborative way to open up the work that you're doing to others who may not be part of the organization. And so for today, we have Erica Anderson. She is the reentry coordinator for the Albany County Reentry Task Force, and I had a chance to speak with Erica briefly the other day, and it was great to hear her passion for the work that she does. And I just want to, before I go much further, just want to recognize some of the SUNY UCAWD staff that have joined us for the call, including Kent Goldwire, who helped us land Erica as one of our open chairs. So thank you so much for making that connection for us. I saw that we have Karen Russo on the line as one of our senior managers, and I believe I saw Dr. Galen Gomes as well, who is one of our senior staff associates. And I believe, if I'm missing anyone, we might have Bob Woodfield, who's one of our senior managers as well. I mentioned Dominique Luke, who is facilitating. And I believe we also have Acacio Wilson, who is also one of our SUNY UCAWD colleagues on the line. And so as part of the open chair opportunity, Mr. Goldwire reached out to Ms. Anderson, and they have been working closely together on partnering to make sure that those of our students who are re-entering from the criminal justice system, that we are being mindful of the work that we're doing to make sure that we're being as inclusive as possible. And Ms. Anderson, she has been working in her field for a number of years, and as the coordinator. And she said that that she is really passionate about assisting men and women who are formerly incarcerated make a positive and sustained entry into the community. So we welcome her. And we also have Marianne DeChristopher. I've known Marianne for a very long time, and her work and her reputation for attention to detail and leadership and analysis is always precedes her. She has worked in the field of addiction for over 47 years in a variety of professional capacities in the private and public sectors. She's someone who is not afraid to lend her opinion or help move the dial on a number of issues. She, as you can see there, she was the former acting associate commissioner of OASIS, and she's the current coordinator of substance abuse services here at SUNY System Administration. So we welcome her as well. And Desmond Francis is also joining us as an open chair. He is a former internal medicine and pediatrics doctor. And internal medicine is a field of practice focused on treating adults regarding preventing diseases, diagnosing, treating diseases that include patients who are dealing with chronically ill symptoms, and as well as those who are dealing with short-term care symptoms. So we welcome him as well. He is not currently practicing, but is available to be able to chime in, and we really appreciate him lending his expertise today. We also have Lady Bravara. She's here. She's from the Bronx EOC as a graduate, and she was in the medical assistant program. And she shared that she is a patient-centered and compassionate medical professional with 10 years of experience in primary care and patient and family collaborative partnerships. She came highly recommended from her director, Ronnie Hector from the Bronx CRC, and from talking to her on the phone, it's very, very evident that she is not only passionate, but she is compassionate about her patients, and she puts them first. So we welcome her as well. So we'll move on to the next. And actually, while I'm queuing up for the presentation, it's always great to see so many directors here. I see Mr. Hector from the Bronx EOC, welcome. I see Dr. Marius from the Rochester EOC. Am I missing any others? I know we have Dr. McGarity, who's going to be coming on with her team from Schenectady. Scrolling through the pages. All right, I think I've gotten everyone. And if I haven't, please send me a note in the chat feature, and I'll make sure that we have an opportunity to officially welcome you as well. All right, the ONET mental health and allied health professionals. So Ms. McKay was talking earlier about her encounter, her, what she was dealing with her family, and her personal encounter with COVID-19. And as we were planning for this presentation as a team, I was, as I was reflecting and pulling together statistics from, from the work that we're doing here at SUNY UCAWD, and also reflecting on my career as an assistant director for the Center for Mental Illness and Homelessness, and also the work that that I was able to do with the team there, working closely with SAMHSA Center for Mental Health Services, and how, you know, all of this comes back round full circle. And my grandmother, who passed away last summer, she was an inspiration to me and our family. And she was, during her final days, she had the opportunity to experience firsthand the excellence that the system provides in terms of the quality of the students that graduate from our program. So there were one or two students from the CNA program at the Capital District EOC who were there as part of the team that took care of my grandmother. And if you knew my mother, who was in charge of just, you know, the whole team and taking care of her care, she's quite a stickler. And the CNA students that came from the Capital District EOC were given just really high praises for their attention to detail, treating my grandmother as if she were family. There was one occasion when my mother got a call at 3 o'clock in the morning. This was not from a CDEOC, a Capital District Educational Opportunity Center graduate. This was from another student, and or someone who had graduated from another program. And my grandmother had, you know, was not responsive, and the home health aide who was there called my mom and was sharing that my grandmother wasn't responsive, and so and she sounded really panicked. And my mom then found herself, because she has a healthcare background, actually coaching the home health aide through how to provide, check for vital statistics and so on. And later on, my mom had an opportunity to talk with the professional and found out that there was just a lot of stuff going on in her home life, and just other things that that impacted her capacity to actually be able to to serve in the way that she had intended to serve. And so it was a reminder, just like those of us in our positions, we have a lot of things going on, both personally and professionally. And also, when you're doing that type of work, you grow really close to people. If you are the type of professional that cares about people and you care about your work, it's like that's your mother, that's your grandmother. So to see someone unresponsive can really be really take a toll. So having the opportunity to get people together to talk about mental health resources for allied health professionals, ways that we who are not allied health professionals can support them, is something that is very, very dear to my heart. And the good news was that my grandmother at the time was, she was able to get the care that she needed, and she really was able to fill out to almost 90. She passed just before her 90th birthday, so I'm very, very thankful for the care that she received. And it all starts, it starts with people like us who, those of us who have the honor and privilege to develop programs, develop services, so that students who then are working on the front line have what they need to do such a vital service. So at SUNY UCAW, and for those of you who may not be familiar, I talked a little bit earlier about our stretch across New York State. And out of looking at data from the last program year, 2018-2019, we have, out of the 10,000 or so students that we have registering for our programs across the system, about 20% of them are part of our allied health programs. And so for this presentation, what I did was I pulled together, and actually with the help of Dan Murphy, who's also one of our SUNY UCAWD colleagues, helped me pull together some preliminary data. And what we did is we focused on students in allied health who are directly taking care of patients. So not necessarily a student that might do medical billing and coding in the back office, but students that are specifically face-to-face with people. Also included medical assistants in that data as well, because depending on their role, they might have more of a face-to-face role. And so what we found is that there were about 1,000 registered students in those classes. So CNA, HHA, LPN. We have an LPN program at the Rochester EOC. That we had about a 70% completion rate. And that is a testament to the excellence of the staff and students and faculty that we have. And so based on that data, we have a lion's share of students that we're serving and that are then going out to the front lines to to help the community, help our family members, to help our friends continue in their care. And so just to take a look at, I just want to go to the United States Department of Labor's ONET database, and this is the Occupational Information Network. And for those of you who are familiar with it or may not be familiar with it, there are more than 1,000 occupations, well, actually just under 1,000 occupations, descriptors about those occupations in ONET. And by a show of hands, we walked through using the technology earlier. A show of hands, how many of you have been on the ONET before? If you could raise your hands. How many? No? Okay. I see yes. Okay. I see a couple. Okay. Maybe maybe about a handful or so. Okay. So I'm going to walk you through. All right. Nice job, Dominique. That looks good. I'm going to walk you through the page that will take us to nursing assistants.
Can you still see my screen, Susan?
Yep, we can see it. All right. So just scrolling down, you see tasks at the top, which gives you a snapshot of the job description. You'll see knowledge there, and you'll see psychology as part of that. Oh yeah, that's great. Okay, that looks good. Yeah, so we're looking at technology skills.
That's why you said I didn't want you to squint.
Oh, okay. You can see me, right? I'm like, oh my gosh, thank God I found my glasses this morning. All right. Thank you, Dominique. All right, so we see technology skills, we see knowledge, psychology is there, medicine and dentistry, for those who are moving on. If you go down to skills, you see it's a service-oriented occupation. Active listening is very important. Being able to, really listen to see what your patients are requiring. I mean, when we think about all of us are not necessarily, experts in terms of having medical degrees, but all of us have either had an experience around health, either mental health or physical health, and having someone who can really listen and help you figure out what's going on is really important. And you see coordination, working with others to make sure that care is done in a way that is done with integrity and fidelity, going down to abilities, work activities. And I want to show you something here, and that's really for those of us who are developing program proposals and we're looking at labor market information. If you scroll down a bit, all right, you will see a little bit more. Let's see what we have. Yep, where it says wage and employment trends. If you click on this tab, you'll be able to search by state and take a look at the average salaries for nursing assistants. So you'll be able to see it and so the red is for New York State. So typically nursing assistants make quite a bit more than other nursing assistants across the country. And so you'll be able to, you know, to look at that and make some decisions, whether you're developing a program proposal or you're instructing. It's a really great tool that you can share with your students or your colleagues if they're job searching, or if they're you know, trying to make a decision about what type of career they'd like to go into. All right, so we're going to close out of that screen. And then I want to show you toward the bottom of this ONET webpage. Okay. All right, you're going to see some resources. I'm going to click on that first one. So this is a resource that is on the ONET webpage, and particularly the nursing assistants one. And it's for hospice updates. There's some COVID-19 updates, and if you click on the essential coronavirus tools and resources for home care and hospice, it will take you to a plethora of both resources that are by state as well as nationally. And what we'll do is we'll include this resource as part of the follow-up notes, and also I can drop a link in the chat. Okay, and there was a question about how do I raise hands again. And just a reminder, the last button down on your screen that says reactions. Thank you, Dr. Barry. Okay. All right, so we'll go to, we'll stay on this slide just for a minute. I just want to point out a couple of things before we go to the recommendations. So what we saw on that ONET webpage for, and I'm just going to ask folks, if you are not presenting, I'm just going to ask you to, okay, thank you. So you'll see on that webpage as well, if you do more digging, it talks about work values, and I mentioned this a little bit, providing service, moral values, social service. If you don't have a caregiver that you can trust, you know, someone who is dispensing medication, someone who, you know, is part of your family, it's, you know, is there. If you're working with a home health aide, you know, someone who is, you know, hearing confidential things, personal things, you know, someone who is there to pitch in and help you as best as possible during a you know, a time of crisis in a lot of cases. All right, so we're going to go to the next slide. And good morning, Erica. All right, good morning, Dr. Meyer. All right, so the resources that ONET has, in addition to labor market information resources, you'll also have lots of other resources from agencies, both locally, you know, by state, and also nationally. And so the World Health Organization has some resources listed there, particularly their Department of Mental Health and Substance Abuse. And this was just from last month. And they had some recommendations for the general public, and they also had recommendations for allied health professionals around mental health during this time. And one of the recommendations was to use people-first language. And I know this is something that we, as an office, you know, whether we're, you know, developing program proposals or helping with the development of them for allied health professionals, or just in how we, you know, how we operate. Putting whatever the designation is after the person, because, you know, this is about, you know, people first, people before the work, people before, you know, before anything. So one of the recommendations is to, instead of saying, you know, COVID-19 patients, but to say people who have COVID-19. If we're talking about people who are homeless, you know, putting that people first language is really important, and helps to train the brain and patterns of actually treating and considering people and making decisions. Particularly for allied health workers, the recommendation was, you know, it's normal to feel pressure. There's a lot of pressure going on, personally, professionally. So to be able to, and I believe Ms. McKay spoke to this as part of her greetings remarks, that, you know, to be able to reach out for help, to be able to say, you know, this is a lot, and to have people that you can trust, that you can share that with, is, you know, is really important. And not to feel that because you're feeling like you're overwhelmed, that that if you share that someone will say, you know, you can't do your job, or, you know, there's an issue there. I would hope that those of us who are supervisors, or those who are supervising allied health professionals, would create that safe space where staff can say, you know what, this is too much, and this is what I'd like to see, and feel comfortable sharing that.
I'm sorry. I gotta mute myself. Sorry.
No worries. That was Karen Russo, one of the senior managers I mentioned earlier. Welcome, Karen. So also, in terms of some of the, there were self-care highlights, and something that I really appreciate that this office does. We have directors retreats, and Miss McKay made a particular point of making sure that we spend that first session talking about self-care, and it's something that we've continued to set time aside during directors meetings or directors updates. And so this report by the World Health Organization focused on self-care as well. And as part of those strategies, you know, it's really important to be particularly keen about health, and as part of, you know, part of mental health, part of stress, you know, not going to strategies that could be in the long term unhealthy, you know, use of tobacco, alcohol, and other drugs, to the point where, you know what, this is something that I need in order to get through this day, because this day is stressful. So we're talking about abusing substances to the point where it can impact you long term. Taking care of yourself, making sure that you're taking breaks. As we were getting on the line, we were talking about, you know, working remotely can really stretch out your day. And as allied health professionals who are adjusting to a new normal of, you know, possibly doing more remotely, they already have long days when they're, you know, when they're there, whether they're you know, working you know, in different contexts. We'll see what the future brings in terms of ways to you know, remotely report in or work with staff, as opposed to going into a particular office, or being able to stagger when people are meeting. We'll see what the recommendations are around physical distancing as we continue to open up as both a state and a country. So I know that later on we're going to hear more about ways to, you know, be healthy and take care of ourselves. So I'm gonna leave it there for now, and then end here before I introduce the next group. This is a picture of my grandmother, and you know, when I look at it, I get reminded of just, you know, the impact of the work that we do. And so I just want to you know, just thank again and encourage all of you who are working on allied health program development, working on wraparound services. We all know that what we do makes a difference, and it's just a pleasure to be your colleague. And it is a pleasure to call this young lady colleague, Dr. Deshawn McGarity. Really appreciate her. When I asked her about doing this, and I knew there was a lot going on for everyone, she's the type of person who is like, you know, if there's something that we can do, you know, we'll see what we can do and make the time to get it done. She has over 20 years of experience in higher education, having served as the executive director of the Schenectady College and Career Outreach Center since 2013. She previously directed opportunity programs at Clarkson University and at SUNY Schenectady. And she is here with her Associate Executive Director, Jamie King, and her Schenectady colleague, Erin Flora. And so I'll pass it over to Dr. McGarity to introduce the rest of her team.
Thank you, Susan. Can you hear me okay? Can everybody hear me? Hi. So essentially, when we were asked, and I want to thank Susan for inviting us to sit on this call or conference, we sat together and really talked about the key elements of what we provide to the system. And we do not have instructional programs per se at Schenectady, but we provide a lot of the wraparound support services to those that we serve. And one of our pathways to access an opportunity is for our participants to either go to an EOC to get into a high school equivalency program, or go to college or find a job. So we provide those support services to our participants. We find often that there are many barriers that impede their success to getting access and to achieving self-sufficiency economically and educationally. So in addition to the services that we provide, we also provide a lot of coaching, a lot of mentoring, a lot of development of skills that we help our participants to merge. So really, we take a holistic approach in how we work with our community and our participants to get them to their next step. So in addition to all of those soft skills that they need, it's also lots of the referral services for really life skills. How do I manage my home situation? How, if I'm homeless, how do I get hooked up to Section 8 or social services? Or how do I get childcare when childcare is very expensive? So we thought that we would today attempt to share with you some tools and approaches and best practices that we use at the center. Certainly, I want to emphasize that I'm sure some of you or most of you have seen some of the things that we'll talk about in your centers. So I hope this serves as maybe something to get you thinking about some of these barriers and how to overcome them with students and participants. So that's really what our focus is today. So I'm going to begin with the first slide, and then I'm going to turn it over to my colleagues. And first, I just want to introduce Jamie King, who will be speaking after I do. She is our Associate Executive Director. And I always brag that Jamie and I have been working together for 11 years. We were fortunate to snag her from the University at Albany 6 years ago, and she was a hall director with me at UAlbany for 5 years. So before that, Jamie worked for St. John's University in the Department of Residential Life, and she has served as an elementary school teacher. She holds a Master's of Arts in Childhood Ed and a Bachelor's of Arts in Communication Arts, both from St. John's, and she also holds a certificate in special education from the College of St. Rose. Our outreach advisor, who joined us in March of 2018, Erin Flora, who just got married in October, and I keep calling her Erin Grimm, but she's now Erin Flora. She has a bachelor's in counseling from Marshall University and a master's degree specializing in community mental health counseling from the College of St. Rose. And Erin is also a licensed mental health counselor. So she kind of underscored herself in that regard. Prior to her employment with the center, she's held a variety of employment positions in the mental health and higher education fields, including positions at the College of St. Rose, Northern Rivers, Family Services, and St. Catherine Center for Children. So with that said, I'm going to get right into our first slide. And so supporting participants or students in breaking down barriers. So essentially, participants, students often run into various barriers that ultimately impede on reaching their career, their educational goals and aspirations that they set for themselves. And we assist participants, and well, I'm going to say students today. We assist students with identifying barriers and navigating support services. And we try to provide individual services to each of them, because we know that a lot of the barriers that they do come to us with are various. And some of those barriers, I believe, based on my years of working with students from all ages and all socioeconomic levels, from the very rich to the very disadvantaged, quite frankly, and ages all the way up to 70, all the way down to youth. Sometimes they don't realize the barriers that are impeding them because they're in their own life cycles or their own situations, that having those conversations and really trying to explore and tease those out can in and of itself sometimes be a challenge. And one of the things that I'm proud of with my team is that I've seen them work miracles with some of our most vulnerable in our community and have turned them around to be successful, to have opportunities. So I am very proud of that. So we must be open to meeting a student's or a potential student where they are. There are some stories that have been very sad and frightening that students have shared with us over the years. And I know we've had other staff, particularly in Erin's position, who were very shocked or very judgmental about those stories. And Jamie and I think it's because of the years of expertise and because we worked in residential life, we've seen it all. So I say that to say that when students come to us, they're comfortable because we're not judgmental. We're not there to laugh or to make fun of their situation or to preach to them about what they've been through. So as a result, we find that students get comfortable and they feel safe in our space at the center, that we can give them all the information that they need, and we encourage them to visit places that they need to go for services. However, many of them, they never follow through for for various reasons. But a lot of times they feel uncomfortable. There might be shame, particularly in the mental health area. They may find that because of family circumstances or their own history, or because of the mental illness that they might be suffering from, that they really think that there's nothing wrong with them. So really, it's about building a trust between the student and the professional to so that they feel comfortable. And sometimes that might not happen in that first meeting. It might not happen in the second meeting. But eventually, and I've seen this with my team, they do begin to come around, and we are able to change their minds and their thinking. And they do come back and say, yes, I did go to Living Resources, or I did contact that person at Access VR to perhaps get tested for a learning disability, or I contacted Ellis Mental Health to talk with someone or to get additional information about what we talked about at that meeting. We invite employers and support services on a regular basis into the center to meet with our students. And we do this with the hopes of providing them with an initial meet and greet so that they will follow through receiving the services, whether it's someone from HUD, so that they can consider maybe home ownership. Someone from Fidelis, so that if they need free healthcare and they just came into the area from another area of the state, that we let them know that those services are out there. And at some point, if my staff want to add additional ones, because I'm talking off the cuff and can't remember the plethora of organizations that come in. We also have employers that conduct one-on-one, as I'm sure many of our colleagues across the state do the same, various one-on-one employer, potential employee recruitment and other services, college services. Folks from the Department of Social Services come down to perhaps discuss the Section 8 housing list, for example. food insecurity resources. We have very strong linkages to those organizations. And when we actually began the shutdown for COVID-19 as a result, I had a lot of organizations, I was very surprised, who called me directly and asked, are you guys still going to be working with folks in our community? And I said, yes, we're working on finding a way. So moving on, we conduct in-person outreach at agencies and organizations that refer individuals to our center, which I think is why there was such an outpouring of phone calls from our partners in the community when this happened. So we request to set up recurring hours to meet with people. We inform them of services, create a foundation with them, and invite them to schedule an appointment at the center. Individuals feel more obligated to follow through with their appointment if they have met you and know what to expect. So we always try to provide that summary of events as we meet with participants. So I'm going to turn it over to my team and I'll be back later on.
All right, can everyone hear me? Okay. My name's Erin. I am the Outreach Advisor. Like Dr. McGarity said, the next couple of slides are going to talk about some of those areas that our participants do run into some barriers when trying to reach their educational or career goals, and how we really provide the supportive service and help them navigate to overcome these barriers. So starting out, one we see rather frequently is different educational barriers at our center. Some of these examples could be no access to internet, so they have trouble researching different colleges, training programs, different vocational programs, things of that nature. They may not have any prior knowledge, or they may be lacking the guidance that's needed to further their education. There are often a lot of steps, and they may not have the prior knowledge of what that entails. They may not have any financial assistance or know where to go for that. Or they may not have obtained the appropriate certifications needed as a prerequisite in order to move forward, high school diplomas or various certifications, things of that nature. So what we really try to do is meet individually with these participants and really help them set their goals and navigate their pathways to reaching their goals. So we do try to focus on, where they're coming from and where they're at, and, setting up a realistic pathway to reach the goals that they're trying to reach. So a lot of times this is, just sitting down with them and helping them navigate the internet with different searches, helping them with the steps of college applications, applying to vocational trainings, or any other kind of training programs that they're interested in. Also includes helping them complete financial aid applications. We do sit down with them, help them gather all their documents for filing FAFSA, or identifying any other options for financial aid or assistance. With that being said, sometimes they do need further assistance, so we are familiar with other organizations in the community that we can refer them to for that additional need. Another area is, disabilities. Oftentimes, the participants that come into our center are entering with various levels of abilities. So some of the barriers that they often run into are finding employment positions or educational opportunities within their ability. So that could, again, be having some difficulty utilizing computers, internet searches, completing applications on their own. So we really try to meet with them and get an individualized approach, because like we said before, people are coming with all level of abilities and their needs will differ. So we really try to make an individualized approach that will really help them meet their personal needs. Again, so that could be, just sitting down with them, helping them navigate the computer, internet searches, completing employment or educational applications, and helping them with any other additional Word documents that might be needed for their applications. Again, if it's something that we may need to refer out to, it's really important to be familiar with the organizations in your community that can help with that. One thing that, we have talked about a lot today already is mental health. So that is something that we do see at our center as well, including substance abuse and mental health issues. So some of those barriers just in general, it provides an inability to move toward their goals due to the mental symptoms that they're experiencing and also the physical symptoms. It really can interfere with their progress. And just the inability overall to complete the service programs that they're registered for, that's really going to help move them forward in their journey. At our center, we don't provide any kind of mental health or substance abuse counseling, but it is really important that we identify that this is an issue often and familiarize ourselves with different partnerships in the community that can help with these areas. Another thing that's really important is establishing relationships with these local treatment centers for referral purposes, and that can really go both ways. If someone comes to our center that discloses that they have some kind of mental health issue or substance abuse issue that they're dealing with, it's really important for us to kind of identify that and know, what kind of referrals can be made. And it goes both ways. If someone is at a treatment center and is at the point in their journey that they're ready for looking for, the next steps in their career or educational path, it's important that, the people at these treatment centers are able to refer them over to us. But with that being said, timing is really, really important because everyone's healing process is different. So if they come to us, if they're referred to us a little too early in their journey, that might pose a barrier in itself. So it's really important that we recognize the timing, the people that are making the referrals recognize that everyone's process is a little bit different. And just to be mindful of where they're coming from, their path, and how that can affect their future. Not everyone will come and disclose everything about their personal history, but it's important to kind of have these honest conversations as much as you can to identify what their issues are in the past. For instance, if someone's coming to us with an issue or a history with substance abuse, it might not be the best idea to encourage them to apply for a job at a pharmacy or working at a bar or a place that they might be exposed to potential triggers. So really understanding that the past can affect their future too. And I think lastly is just kind of approaching the situation with an empathetic and open attitude and just kind of provide a warm environment for them to really feel empowered in moving toward their goals. And again, referring out to community resources as needed. And now we will move on to a couple more areas that we run into with barriers.
Good morning, everybody. My name is Jamie. As Dr. McGarity mentioned, I am the Associate Executive Director at the center. Another area that we see a lot of barriers is with returning citizens that come into the center. Some of the barriers that they face are a lack of knowledge of community resources that are there for them to help them kind of get back in and stay focused. Difficulty with obtaining and maintaining employment due to being previously incarcerated. And needing support throughout the process, job search, application process, getting into school, and kind of finding the right fit for them. So we help them with all those areas. Some of the support services that we offer for this population is identify agencies within your community that assist the incarcerated individuals with reentering into society. It's very important for us to maintain partnerships with them. There's groups out there that have task force meetings, to attend those task force meetings and be in the know, stay informed. And it's a great opportunity at these meetings and in dealing with these places to network with other agencies in your area that you can refer them to and that can also help you best help them. They also are a huge source of referral for us anyway. They send us a lot of people over, as well as when we come into meeting with people that have been previously incarcerated, we can then refer them to help them kind of get through some other barriers that they're dealing with that we don't necessarily help them with. Another thing you could do is reach out to the local jails in your area. and talk to them about ways that you can work with individuals that will soon be released. That way they can start getting the supportive services before they've even re-entered into the community. That way they feel supported and they feel like you're there for them, and then they're going to follow through with coming to see you and getting the help that they need, that you have to offer them, which also will reduce recidivism. Have open and honest conversations with these individuals that have criminal past. Let them know this is a judgment-free zone so that they feel they can be open and honest with you and that you can guide them appropriately. That will also help them have open and honest conversations when they're going to meet with potential employers and places with education opportunities. That way people, they're following the right path. You don't want to direct them to an area that they can't pursue later on. Like for instance, a lot of places are offering, a lot of employers are offering second chances, and that's amazing, but not every place can for different reasons, whether it's liabilities, insurance, things like that. So make sure you're aware of what their criminal record is and what they can or cannot do moving forward, and making them aware of that so that they're following through, because looking for a job and trying to get into an educational opportunity really is a lot of work. And if they're chasing something that they can't meet, they're going to get discouraged. So again, also always refer out to other places that can assist them as well. Housing and food insecurity is huge. Lucky our community is huge, has a lot of resources for this. So a lot of the barriers we'll see is lack of financial funds to even purchase food, homelessness or unstable housing, lack of knowledge of community resources. So identify all of the food pantries, soup kitchens, homeless shelters in your area, partner with them, have their information on hand. That way, if you run into somebody that's new to the community, you have stuff to give them and send out, as well as when they have people that are staying there or going there for food service, they can refer them to you to help them kind of get on their feet. We go into a lot of the food pantries and the soup kitchens, and we table. As they're entering in, we welcome them, we let them know who we are, why we're there, hand them information, and kind of meet and greet with them right there on site, and welcome them to come see us, and then they know and understand how we can best help them. And as always, maintain partnerships with your local DSS social services office, because again, they will refer just as much as we can refer, and always have up-to-date information in the center to provide them with, so they have the proper information that they need. And again, refer participants or students, out to community resources as needed, as best see fit. Healthcare is a huge barrier for many people. Lacking healthcare and insurance coverage, lacking transportation to and from appointments is huge. A lot of people go untreated because they can't get to their appointments, or don't have money for their medications or their treatments. So we actually, as Dr. McGarity mentioned earlier, I believe, we actually host outreach recruitment for insurance companies right in our center. They come in, they've got tons of information. They're so helpful. They are there and ready to chat with anybody. Even if you already have insurance, they're willing to sit down with you to navigate all of what they do offer for you. So yes, you might have insurance, but you don't realize that you can, get signed up for transportation to and from your appointments. You don't realize, what the medications cover, stuff like that. So another great thing is their placement. So sometimes they come in and they sit in the center and they assist people that are already coming in. And we also have some that actually come out and sit in the hallway, and they'll get the ongoing traffic. So not only are they helping your participants or your students, they're also catching people out in the public, that, the foot traffic, and then they're also learning about the center. So it's kind of a nice little extra piece that we're actually able to gain more students to come in, just off of the knowledge of them telling who we are and why they're sitting out front, and also getting their health care. And it's also very important, these people are not always there, so we always make sure that we have updated printed materials for them to take if they need it, as well as we keep all the reps from the insurance companies' names and contact information on hand, so that anytime anybody comes in with any type of crisis or need to speak with a rep or to sign up for insurance, they can call them and they'll come down to the center and meet with them rather quickly. And as well as everything else, we always have different community resources that we keep a list of to send out, to refer them to if needed.
And lastly, another barrier that we see a lot of certainly is childcare, and I'm sure that many of you, our colleagues, see that also. And as a result, folks are unable to maintain their employment due to missing work or school or training programs because there is no childcare or lack thereof, and there's no funding. As you know, for those of you who are parents, childcare is an expensive endeavor. They're unable, a lot of times we see often that students are unable to make appointments or to keep their appointments, whether it's at the center, whether it's at other agencies, due to lack of childcare. I know there have been challenges in the past with some of our participants or students who really missed out on interview opportunities, quite honestly, because they thought that they had a dependable person to take care of their child or their children, and then that person kind of canceled on them at the last minute, and they were unable to keep their whatever they needed to do. So the supportive services that we maintain at the center is keeping partnerships with local child care centers that offer financial assistance for child care, keeping updated on brochures in the center for referral purposes. And I will say, one of the things about Schenectady County that does make our job a little easier, as Jamie pointed out, is that it is a very resource-rich community. And so we receive a resource guide, and many of the organizations here in Schenectady County maintain very plentiful resource booklets that we obtain from the County of Schenectady or from social services, that we can take a look at that information and try our best to share with our folks coming through our doors what is available in the community. We assist our students with obtaining and completing child care applications, as well as applications for financial assistance. And we refer participants to community resources as needed. Are there any questions? So if obviously our contact information is on this slide, SCCOC at SUNY-SCCC.edu, and our main contact number. And I will say that in these times, both of those contact informations are operational, fully operational. So if you have questions, you can contact us at any time and we will immediately get back to you. Thank you.
All right, thank you so much, Dr. McGarity. And I think people are being respectful of the time, but I'm sure there are questions that people have. So please feel free to include them in the chat and or utilize the email address that Dr. McGarity shared. And we'll make sure that we share that as part of our follow-up with a copy of this PowerPoint and also a copy of the recording. So thank you so much for that presentation about wraparound services. So we started off, talking about a U.S. Department of Labor resource, kind of framing the discussion, talking about wraparound services. And now what we're going to do is there's a video that you get an opportunity to preview. It is short. It's like a promo. It's a commercial, and it features the work that our students do working on the front lines. So we're going to show that in just a second. So, and kudos to Christopher Ellis from our office, and Daniel Murphy, and all of the others that, Acacia Wilson, that have worked on this. And while we're, okay, awesome.
As a result of the coronavirus pandemic, we are all adapting to living with social distancing, working from home, and homeschooling our children. Through this experience, we have come to realize one very important thing, that all of the healthcare workers on the front line are true heroes. No one could have imagined the significance of your role in such a crisis when you completed the course requirements for your allied health program. Yet here you are today, bravely taking the risk on a daily basis to help reduce the spread of this terrible disease. Thank you for being a living example of what true heroes are. Your family at SUNY EOC is sincerely grateful.
All right, great, excellent, excellent, excellent. Yes, yes, clapping hands. I'm going down to my reaction, my reaction bar. So you can only imagine, any of you who've worked, with audiovisual, that you have a lot of footage to get down to a minute of what you really want to show. And so that is a snapshot of the efforts of the system. And so thank you for being one of the first cohort of groups to view that. And that will be, I saw one question in the chat. When can we access it? And thank you, Ocasio. It is posted on the SUNY UConn page.
And I just posted the YouTube link in there, so you can go right on and click that. But please feel free to go on to SUNY UConn and like and share.
Awesome, thank you, Dominique. And I saw a note from Mr. Hector as we're going to get queued up for Brooklyn's presentation. What about domestic violence? And so, yeah, domestic violence is, I used to work for, at the time it was called Albany County Rape Crisis, actually, and we partnered with the Crime Victims Assistance Center. And working with individuals to, as I believe Erin had talked about, and in particular, just working with individuals and realizing that everyone's healing process is different. That's a really important theme, and I think we're going to hear a lot more about that as we go into our next segment. And to round out this meeting, we're just going to go to that slide. So mental health and physical health. We're going to end with taking a look at that. We've talked about it in the other presentations a bit, where we're going to have an opportunity to hone in during our final time here. And I just want to share a few words about Ms. Williams-Nicholas. Really appreciate her for spending her time here today and preparing for this presentation. She's worked in within the human-centered sector for the past 15 years, and prior to joining Brooklyn Educational Opportunity Center, she was employed in positions primarily dedicated to improving the mental health of various populations. One of her quotes is that she enjoys helping individuals go from "I can't" to "I will." And she says an important virtue is that she has learned that patience is also a form of action. So we welcome her and look forward to her presentation.
Hi.
Hi.
Good morning. I'm really happy to be here today. And again, I'm Marcia from the Brooklyn EOC, and I'm just ready to share some skills and what we can do and how we can really help our students. And just one thing, at the Brooklyn EOC, what we do every semester is a series of mental health workshops that really help our students to prepare for the field or just whatever they're going through on a daily basis, and just to ask for help. I think someone said it's the timing and when they're ready, and also to provide that safe space and feeling comfortable and being in a space where there's no judgment. So yes. you can, Susan, you can, thank you. A lot of the time we focus on our physical health and not so much our mental health. And also I see this in our students. And few things I want to talk about today is why is mental health critical during COVID-19? Ways to improve our mental health and what are the available resources? And just a little bit to talk about the balance and the imbalance of mental health services and taking care of self, right? So why is mental health critical and important? For our students, I feel like they're like so in the sense of clinical space where they have to take care of people, take care of family, so therefore they forget about themselves. And also I want to think about the stigma, especially just imagine the students that's providing services to the population or to people and asking for mental health services. So something that I saw that was really important is that seeking a therapist does not mean that there's something wrong with you. It means that you may be seeking clarity, which sometimes, of course, we're always seeking clarity, or working through traumatic experiences. And we know that what's going on now is really traumatic for all of us, and finding the right way and the right techniques to really get through day by day and dealing with our new normal, right? Also focusing on personal growth when it comes to mental health. We're providing services. Students are giving back and giving so much of themselves to family again, and to taking care of other people or other patients. So that's very, very important for us to really enlighten them that it's okay, to remove the stigma, the way how we see and the labels that we put on, people that seek mental health treatments. So asking for help is very, very important, and that's the message that we want to really drive home to our students, to let them know nothing is wrong with that. So while I was doing the research, going and stuff, I came across this PDF file. This is free digital mental health resources. And because we're also doing social distancing, I find that this um, resource sheet is very, very helpful. I've gone through all of the links on this page, and Headspace is one amazing new mental digital resource. There's a wealth of information in all of them. So, where it says anxiety, depression, and even also for sleeping. And once you click on any one of these links, it also takes you to videos that you can listen to. It talks about anxiety, depression. It takes you to also literature. And even if you don't want to speak to someone, you can also text them. So we have something on this page for everyone. The time people like to speak, but they like to text because we're in a technology society. So it's amazing. Also, one of my favorite is the Big Health Sleepio. That is also a very good one. Ginger is also a good one. And also a big piece that we need to remind students is that their peers are also their support. Um, again, because of the stigma, people don't like to talk to a therapist. Something is wrong with you, or see a psychiatrist. But peer support is very, very important. And I will share the sheet. I'll send the sheet if you guys need it. So you'll have it to share. But this is really good resources. And I think there's so many other resources out there right now, but this was one of the most, I find this to be really important. I find this to be very, that everyone can use. So this is really cool. So yoga, meditation, all of that is on here. Again, so for folks or for students who feel like, okay, I don't want to talk to anyone, what can I do on my own, which is very important. And it says make time for fun and relaxation. So go for a walk, watch comedy. I did not realize, my supervisor, my director at the EOC, she always tell me, Marcia, I watch comedy to make sure, I get a laugh. And then I was doing a research, and it says that watching comedy also stimulates um, dopamine and serotonin and create happy thoughts in people and decreases anxiety. And I said to her, I always, think she was just joking, but there's also research that supports that. Um, Call a good friend, write in your journal. Coloring is a big deal right now for adults, especially, it and there's also research that support that coloring also brings back childhood memory. It increases happier neurotransmitters and just helps you to relax. Enjoy a cup of coffee or tea, depends on what you like, and listen to music. Also, when it comes to music, it depends on the music that you're listening to. Somebody said that they're Cruella baby. Um, depends on the music that you're listening to. You want to listen to music that is really calming, soothing, that will elicit positive thoughts. So these are some of the things that we really share with our students, especially throughout the semester. And I know somebody also said that they refer their students or provide other support services, and that's also something that we do at the BEOC. So where it says balance is the key to life. Again, once it depends for everyone, and it will varies for people. Again, I remember in one of my workshop, one of my students, she said to me, we're always trying to lose weight and look different. And I said to her, we need to also mentally detoxify our bodies. And she said, how can you mentally detoxify your mind? And I said, yes, we can. And she said, I never thought about that, that we try to look good physically, we forget about the mental piece. And that was such a big catharsis for her to think about, yes, I can really detoxify my mind. And balance is very difficult. And we know that um, as parents, as workers, we know that it's hard to find balance and find time for ourselves, but it's very, very important that we do that. And it's very important that we set that and drive that home to our students, that even taking 10 minutes for themselves or 20 minutes out of the day is very important to just regroup and work on their mental health, and just to feel in the moment, validate whatever they're feeling and adopt and move on. Yes. So, messages coming in. All right, guys. So thank you so much. I'm not sure if you guys have any questions for me. Um, Somebody said something about domestic violence, and one thing we want to give highlight to when it comes to domestic violence is that because we're so overwhelmed with COVID-19, domestic violence is also on the rise. And I do have some resources for domestic violence, which I will send to you guys also.
All right, excellent. Thank you so much. And we really appreciate being able to, have some time today to focus on mental health. And Marcia, I really like the way that you really honed in on the mind-body connection. And we received a number of messages regarding tools and resources that you referenced, and it was great to have that as part of this discussion around wraparound supports and Schenectady, so people can see a snapshot of what we do as a system, and to start off with, okay, what do allied health professionals do? What's going on in their day-to-day, and look at a resource where we can find additional mental health resources and research regarding it. So it is about to be at the end of our time together. There's so much that we wanted to cover, and we've been able to take a look at a snapshot of it. We really appreciate all of you for taking time out of your day today to join us for this conversation around mental health and the allied health profession. We hope that as you leave, and if you're developing programs and services for this very special profession, that you've received some, takeaways or some other things to think about. If you are here and you're just, curious and you're, learning more about our system, we're hoping that you can take away some personal or professional takeaways that you can utilize today. So on that note, thank you so much for attending. I'm looking at my boss here to see if there's anything more that she would like to add before we close.
No, just thank you to all of the presenters. I think it was time well spent. I appreciate it. Looking forward to diving into the resources Donna is showing us, the digital coloring that she did online, which is fantastic. But thank you for everyone that presented and for those who attended today. It was very good.
Great. All right. Thank you, everyone. Have a great rest of your day.
Thank you,
Thank
Lisa.
you.
Have a good weekend.
Thank you.
Bye-bye.
Bye.
Happy Friday.
Have a great weekend.
Okay.